Guys, it's always so inspiring to see people who have come through so many difficult times as you have, Adele, to do that today and to inspire so many other people. And Sophie, you just keep on impressing every year.
Oh, amazing that, isn't it? Southport's very own Adele Roberts running the London Marathon yesterday. 3 hours, 30 minutes, 22 seconds. Wow, that is amazing. The story is so inspiring, but maybe you're listening along thinking, what's a stoma? And what challenges does it present for people like Adele who are recovering from bowel cancer and surgery? Well, April is Bowel Cancer Awareness Month, so it's the perfect opportunity to learn more about the disease. We will also shortly be joined by someone who lives with a stoma, but first I've got Dr. Ash Bassi, who is a bowel cancer consultant. Thank you so much for coming on today. Firstly, it's Bowel Cancer Awareness Month. Why is it so important to have these events?
It is really, really important for people to be aware of the bowel cancer and the symptoms that come with it. And the reason why I say this is because bowel cancer in some ways is a treatable condition if we find it early. And it's so important that everybody presents to us as soon as they have any symptoms which are suggestive of bowel cancer, because if we can find the bowel cancer at very early stages, then we can treat it completely and people can then live as normal. And that is why it's important that if anybody notices any change in their bowel habits, or they notice any blood, or they have any symptoms such as abdominal pain, which is not otherwise explained, or you start losing weight, it's important to present to your doctor. And what the doctor is able to do for you is take a little bit of your poo sample and look for microscopic blood. And if there is any microscopic bleeding, that could be an early sign of cancer, or a sign of polyps, which is precancerous. And in that case, people undergo a colonoscopy, which is a camera test of your bowel, and we can either detect the cancer at a very early stage, or can remove the polyps so that you don't develop cancer. And the advantage of detecting the cancer at a very early stage is that it is completely curable. And that's why my plea to everyone would be that if you have any symptoms which are suggestive of any change of bowel habits or any bleeding, then you should present to your doctor as soon as possible. But it goes beyond that. Because nowadays, sometimes you can actually detect microscopic blood even before you develop symptoms. And therefore, there is the bowel cancer screening program in which a kit is sent to your home to look for microscopic blood in your poo. And I would urge everyone to participate in that program if you've been sent that kit. We do know that in Northwest, we've got one of the lowest pickup rate for people to do this test. But we do know that if people do the test, we can detect the cancer at a very early stage. So my plea is that if you do get that kit, please return it.
Definitely. And for anyone who's listening now who maybe isn't aware what a stoma bag is, can you tell us what it is and when and why they are used?
Yeah. So a stoma is used when the section of the bowel is removed and the bowel cannot be joined back together. This is when the end of the bowel is brought out through the opening on the tummy wall. The most common cause of people having stoma is bowel cancer, but there may be other conditions such as inflammation of the bowel, and if that requires surgery, or diverticulitis, and that's when people may require stoma as well. It's basically most often done as a keyhole surgery, but it can be done as an open surgery as well. Though usually, I must say, keyhole is the preferred option nowadays. So stoma is just a way of bypassing, by which your stools are not passing through your bottom end, but are coming into this bag through this opening of your bowel, or attached to the tummy wall.
Yeah. Glyn Salmon is a patient's representative for Cheshire and Merseyside Cancer Alliance and joins me now as well. How are you, Glyn? You okay?
Hi, Jade. How are you?
I'm good, thank you so much. Thanks so much for being on the show today. Your cancer journey started a few years ago now, didn't it? Can you tell us a little bit about that?
It did. Polyps in my early 30s, and then about 10 years ago, started having symptoms typical of what the doctors just said, really. Blood in my poo, severe bloating, and then one of the polyps became too enlarged, and that became cancerous, and that was removed. So chemotherapy, radiotherapy, And then 2 years later, I actually got a tumour on my backside. That was followed by an 11-hour operation, and a stoma was fitted.
I see. And like Adele, you've always been an active person. How was your treatment and living with the stoma? Has it affected your life and your hobbies?
It has initially, but that's more the after effects of the treatment. But I've really kept up the activity. I was back in the gym 2 months after the operation.
Wow.
And because I couldn't ride a bike anymore, I bought myself a recumbent trike. And
what's that? What is it?
It's like a paracyclist.
Okay.
You know, like you see at the Olympics, but you're not as flat. You're slightly reclined.
Yeah.
And having a fabulous cycling group that I was with, they got me back on my feet, and we've been over the Alps. And last year we did a ride to the sun, which was a midnight ride of 100 miles from Carlisle to Edinburgh. So just fantastic. I just still love my exercise, Jade. I love
that. And I was going to say, you know, it's Adel's been so inspired in running the London Marathon, but you're just as inspiring as well, being able to do things like that.
Well, I mean, people say that, but that's for everybody else to say. But if it helps somebody, then it's a benefit, isn't it, love?
Of course it is. And if you could talk to somebody now who might be, maybe like yourself, might be feeling a little bit bloated, maybe thinking there's something up with them, and it's kind of burying their heads in the sand, what would you like to say to them?
The tests for the NHS are free.
Yeah.
Why not use something that's free? Because it can save your life.
Definitely. And anything you'd like, what messages would you like to give anybody else? What you think about, bowel cancer or just cancer in general? Anything else you'd like to say?
Well, it's important that you talk to people. That's what I found. And even when I was told that I had cancer, that you get so much inspiration because you're not actually on your own with it, Jade. You get so much help from the NHS, but also the patients that go through it.
Yeah.
But it is important to talk.
Yes, so important to talk, isn't it? Back to you, Dr. Ash Bassi. Thanks for joining us. Would you like to echo what Glyn said there?
Absolutely. And I'll just try to reiterate my message is that if you have the symptoms, present early, we can do things for you and we can treat this condition. Just assume that this is a condition that can be completely cured. And we've got lots of people with good news story because they've lived happily ever after.
Lovely. And that is Glyn Salmon as well, living happily ever after. Lovely, positive stories for us this morning. Dr. Ash Bassi and Glyn Salmon, thank you so much for your time today.